What would you do if a patient came to the emergency department after coughing up this? Let's go through this case report of a patient who actually coughed up her cervical hardware. Are you kidding me? It's an extremely rare complication, but yes, you can have erosion of cervical hardware into the esophagus, and theoretically, you can cough it up. I want to go through this crazy story. This was a 51-year-old female who had a C2-3 and 3-4 anterior cervical discectomy infusion for spinal stenosis. Basically, a surgeon removed the disc in her neck and replaced it with a cage with integrated screws that looks something like this. In the case report, it says that the patient had dysphagia or trouble swallowing well after the procedure, which is not uncommon of a surgery like this. Symptoms waxed and waned, and she was actually evaluated by an ENT and had an endoscopy and was recommended dilation of her esophagus, but she never had that done because her symptoms seemed to be getting better. Fast forward 18 months later, and she represented with worsening trouble swallowing and worsening neck pain, and this x-ray was done. Here you see the anterior cervical construct literally sitting in her esophagus and was expelled from her spine. Here's the CAT scan that was done where you see that the hardware is literally sitting outside of her spine. They told her that she needed surgery, and they gave her the option of being admitted or going home and coming back the next day for surgery, and she decided to go home. That night she went home and was sitting at her computer and had a coughing fit and coughed up her entire construct. These are pictures that she actually took herself. After she coughed it up, she said she felt immediate relief of her neck pain and trouble swallowing. Well, obviously. Here are her x-rays after she coughed up her hardware. They chose to treat this conservatively. They put a feeding tube in, and she could not eat by mouth, and diverted all of her foods through the feeding tube, and the hole in her esophagus healed without complication after about 6 months. She was offered a revision spinal fusion, but declined, has had no additional surgery at this time, and is reportedly doing okay. So how the heck can this happen? The esophagus sits literally right in front of the spine. So if there is any hardware that is rubbing against the back layer of the esophagus, theoretically you can have a perforation. Obviously this is extraordinarily rare, and the chance of this happening is less than 1%. Now, I've never seen this happen before, but I have seen many cervical plates that have eroded through the esophagus where we've had to go in, remove the hardware, and repair the esophagus. In medicine, we can see some crazy things.